We've been crushing medical dramas, but how about a little medical comedy to break the mold? Let's check out the first few episodes of St. Denis Medical. Huge thanks to ZocDoc for sponsoring this video. Let's get started. Beep-whoop.
Okay, got your packed lunch.
Oh, thank you,
Some
ma'am.
treats from the vending machine on me.
Yeah.
And this is the number for that drug treatment center, okay? It's the same one I told you about the last 3 times you OD'd.
I know, I'll call him.
He overdosed 3 times and you're just like being very casual about it.
No more, I promise. No drugs from now on.
Okay, good. Listen, if you are gonna use again, as a nurse, I have access to some really good stuff and I will hook you up, okay?
Does she mean like good stuff like Narcan to prevent an overdose? Which, by the way, is over the counter now.
Yeah, let's do that.
No, man. That was a test. See?
Yeah.
We need to get a social psychologist in there, some kind of social work.
You wanna rehearse it again?
I didn't know we were
Do you
gonna
want
be...
some drugs? And you say, no.
No.
This is like the DARE program for schools. It turned out to be a complete failure, I believe.
When I was a kid, I really wanted to be a doctor.
And then when I was in college, my nan got sick, so we spent a lot of time in the hospital.
And they realized that when they're sick, they actually don't spend that much time with doctors, and they realize they want to be a nurse.
That's when I realized that the nurses really provide the care part of healthcare. So I became an RN, and I love it. You know, it's not always glamorous.
What was she putting on the skin there? I wonder what that was. It looked like lubricant.
Mr. Flynn, those are supposed to open in the back.
I don't want you to see my tushy.
I mean, it's not a bad answer.
I got a promotion, and so I am officially a supervising nurse. Came with a small pay bump and a large responsibility bump. So it's been a little difficult finding that work-life balance, but you know, it's good. It'll be good. It'll be good.
The laugh tells it all.
We do a whole intake, fever, aches, he probably has the flu, give him liquids and a PCR. Unless...
Liquids and a PCR. A PCR is the test that we would do to make the diagnosis. Why would we make the diagnosis, give the treatment, and then test? Seems a bit out of order.
Forgive me, Ron, but things aren't always what they seem.
Oh my God, I remember him from House of Lies. Wow, what a throwback.
Okay, folks, say hello to Mr. Owens. He is a father of 3. Had a little fender bender this morning, so we'll be repairing his right femur.
I think in a situation like this, you'd probably get ortho involved.
Let's take a deep breath in, step into a space of gratitude, and get in the zone.
Oh no, he's no longer sterile. He touched the bottom of his outfit. Surgeons do listen to music, so this is not inaccurate. Everyone has their own jam. I even asked this question to Sanjay Gupta.
So I have my cranial playlist, 2 of them, which is an opening cranial playlist, a closing. Then I have an opening spine playlist and a closing.
You have like a true symphony happening.
I do.
Why do I do what I do? Is a question you might ask. Well,
And he has the wrong medical symbol on his scrubs. That's the symbol for like gamblers, hucksters, and thieves or something. But people associate it with medicine.
Welcome to St. Denis Medical Center, an international medical destination. It's what I hope to be saying in about 5 to 10 years' time.
I always find it weird that hospital systems have advertising departments and they spend money actually putting ads encouraging patients to come for their specialized care and treatments. It's like, why don't we use that money to actually help patients?
We are a safety net hospital, which means we provide care to everyone, regardless of insurance or financial status. But that just means we have to work extra hard and stay positive. Hey, you guys. What is it that I always say? What's the most infectious thing in a hospital?
People who cough without a face mask on?
C. diff?
Oh, C. diff spreads like wildfire. Even hand sanitizer doesn't fully get rid of the spores. You need to wash your hands.
No.
antibiotic-resistant staph.
No.
I think it's pneumonia.
Or it could be urinary tract infections due to long-standing catheters.
No. You guys, the most infectious thing in a hospital
Is
is
a smile?
A smile.
I knew it.
I've never heard you say that before.
I say it all the time. This is the...
When corporate comes into the actual clinical part of the hospital.
Well, why don't you tell us about a typical day in the ER? And don't tone it down. They want it raw.
Wow. Where to begin? Well, I just examined a patient with a heart murmur. That took about 2 minutes. Now I'm going to spend 40 minutes filling out electronic health records. That's a party.
That's very true. For every patient encounter, we're spending like 20 extra minutes filling out forms. There was a study done on this with more correct data, but it's truly incredible how much time we spend not getting compensated for documentation. A lot of times we're doing that on our own time.
I have a very robust personal life. I play the marimba, which means weekly lessons and recitals. I've got my nuts. I love my nuts. I am a bone brother and a mugger, meaning I make mugs. I don't steal from people. But there is personal life and business life, and never the two shall meet.
Why can't you make mugs with your patients? I feel like that's a fun activity. Teaching someone in occupational therapy how to work a knot? Sounds fun. Not. You laugh.
Women from as far away as Idaho are gonna come to St. Denis because we have the best breast test in the West. Best breast test in the West. You guys, St. Denis, the best breast test in the West. What do you think?
Sure.
Yes. I handle most of our PR.
That's how most hospitals treat social media. They're like, oh, just let the interns run it. And I'm like, no, you're communicating with your patients. Would you say send out forms that have been vetted by your attorneys? Think of social media much in the same way.
Before I upload the software, are you sure you have the bandwidth? We usually install these at bigger hospitals.
Well, newsflash, we are just as good as any of those bigger hospitals, so full speed ahead.
So you're running over 1,000 megs. Great, okay.
When the hospital systems go out and we can't document on electronic health records, we have to go back to paper charts, and it feels like you've turned into a full-on dinosaur.
Oh no.
I think the whole system just went down.
Did we just lose everything?
It's all right, don't panic. I can still save this. It's kind of what I do. Here we go. All right, come on.
Oh, those aren't even good chest compressions, bro.
Stay with me. I'm kidding. It's dead. It's gone.
We need to call the IT guy. Can somebody go Mark now?
Come on, I can't go now.
When that happens in the middle of charting and you've documented a long case and then you just lose it all, it hurts down to the core of your soul.
This doesn't have to be your problem. If you leave now, it won't be. Seriously,
Big problem,
go
big problem.
now.
We thrive in these moments. Alex, you look like how I feel. Come on, baby, I need you. Let's go.
And you missed it.
It's equally important to have emergent doctors on call as emergent IT support for hospitals these days on call.
Again, I don't know why the system went down, but IT is on the case, and they're gonna get everything up and running in no time, all right?
What are the nurses supposed to do in the meantime? All the patient information's on the computer.
It's on the computer. We can't scan medications in and out. It's truly a disaster when this happens.
It's been hours, and your computers are not my problem.
Please.
You're my problem. You don't listen.
Okay. I hear you. I'm gonna give you the number for the person who can help you. All right? That's the White House. Ask for Joe. Tell him there's a nursing shortage and we need him to fix the healthcare system. Next.
That's a totally normal thing to say in the hospital. Back to the show in just a second, but first I want to tell you about my sponsor, ZocDoc, a free website where you can easily search and compare high-quality in-network doctors so you can find the right one for you. Based on what I've seen so far, I'm not sure how confident I would feel getting real treatment from any of the doctors at St. Denis Medical Center, which is why I would turn to ZocDoc, who can help you book in-network appointments with more than 150,000 providers across all 50 states. Finding a doctor is not just hard for patients, but for me too. That's right, just because I'm a physician doesn't mean I understand booking appointments and insurance. My dad and I have actually struggled with this together. He's a family medicine doc too, and ran into a personal health problem, needed to find a new doctor. We tried to find someone, but we ran into all the same confusing websites and endless voicemails you all do. So we tried ZocDoc and found the right person. They specialized in exactly what my dad needed, were nearby, and actually had openings for new patients. My favorite part, you can see the doctor's actual appointment openings, choose a time that works for you, and click to instantly book a visit. So stop putting off those doctor's appointments and go to ZocDoc.com/Dr. Mike, also linked in the description, to find and instantly book a top-rated doctor today. All right, let's see if the team at St. Denis can pull themselves together.
I never knew I was allergic to avocados.
Yeah, they're silent killers.
Avocados are not silent killers. In fact, lots of healthy fat.
I got the EpiPen.
Great. He's gonna give you the shot.
You want me to? Not a problem, because I am a nurse, so...
He's convincing himself. Read the instructions on the pen.
Here we go, just quick stab in the leg. All right, 3, 2, 1, stick!
Oh!
Okay, wrong side. Got myself. That's intense, huh?
You okay?
I feel like I need to go to the hospital.
You can't, you gotta read the instruction and never put your finger on top of it. We even have training pens for this exact scenario. I think I have one.
Do you think it's possible for somebody's heart to be like too fast?
Yeah, if you dose yourself with epinephrine, your heart will go fast and you should be monitored at the very least with an EKG.
Hey, Alex, I stabbed myself.
Not my problem, newbie. I'm on my way out. You have to hear this.
This is technically a workplace injury and occupational health should be involved.
One pair of pants later.
Hey, Val, the patient in 4 is hooked up to a respirator, but he's got a sheet over his head. Is that like a sleep hack or?
Oh, he passed away this morning. The ultimate sleep hack.
The ultimate sleep hack.
He's an organ donor, so we have to keep his heart beating until the procurement team comes.
Organ donor? That's kind of gross.
Is it? I'm a donor.
Lots of myths circulating about that.
So, what's on your mind, Matthew?
Oh, just a quick surgery question. If I were an organ donor, would you like kind of try less hard to save me so you could?
No, it's separate teams, separate departments. Like we try to save everyone.
Well, I mean, I'm just one little life, but if I died, you know, somebody would get my lungs, my kidneys, my heart. I mean, you would save like a dozen extra people.
Yes. No.
This isn't a trolley problem.
Ma'am, are you sure you're okay? Oh, God.
Oh no.
Oh, my God.
Patient down.
Ma'am, I'm coming. I'm coming.
Check her for a pulse, and if there's no pulse, she's not breathing CPR after you call 911.
1A. Yeah. Back at the door. Yep.
Does she have a pulse?
Her breathing's really shallow. It's our IV, wide open. Get her on the monitor right away. Yep. We need some doctors in here. Call code blue respiratory.
Yep.
Code blue, that means she's pulseless.
How are we doing?
Why are we doing chest compressions?
Code blue.
Starting compressions?
Code blue in here.
Matt, you clear?
Oh, the compressions are so bad.
Is there a button I'm supposed to push or something? I've never used one of these before. Hey.
Oh my God, what is this? It's locked out, full body, 2 inches deep, allow the chest to recoil, about 100 beats per minute.
Code blue, I repeat, code blue, report to the trauma room.
Now, you really need to sign this.
Okay, yes, I know. I'm just, considering all sides and, oh no. What's going on?
Where are the doctors?
She's a doctor.
Well, I already...
Code blue.
We've got a code blue in trauma 1A.
I think you need to press that button.
Why is the trauma surgeon running? That's not helpful in this moment.
She fell and...
What's happening?
He put his stethoscope on. What are you gonna do with the stethoscope?
Parking lot, shallow breathing, hypoxic, 83%. We lost her pulse.
She was in the waiting room.
Yeah, so do we have a rhythm? Is a defibrillator on? What's going on?
Sounds like DVT turned pulmonary. Let's get some heparin in here.
DVT turned pulmonary? You're diagnosing a pulmonary embolism based on what? This is the most inaccurate thing I've ever seen.
Sounds like a smoker. Could be pneumothorax.
Pneumothorax based on a smoker? This doesn't make any sense. He's saying she has a collapsed lung.
All right, let's get her stabilized. We'll do a CT scan.
What stabilized? There's no pulse!
So blood clot in her leg triggered a pulmonary embolism, and that in turn caused her lung to collapse, which is pretty rare.
It's just making up.
We're like the Avengers, you know? Like Bruce is Iron Man, and Alex is Captain America, and Dr. Ron is Professor X, and then there's me. Guy who knows how to work a breathing bag. Man.
I would ask him how many breaths per minute he's supposed to give, just to see if he knows that you should give 1 breath every 6 seconds.
So, yeah, I think I'm in the right place.
He's definitely getting fired. He's so bad.
He's awful. Come on. Oh, and her car died? That sucks. You need to carry one of those things in your car that's like a portable jump starter. Noco something. I have one of them. They're pretty awesome.
Hey.
Sir, I am not in the mood to be assaulted by a stranger right now.
They told me that you're the one that saved my Lori.
Oh, your wife.
She's blood all over her dress.
Thank you. Thank you.
Who told him that? And how did he find her in this empty parking lot?
That's gotta feel good. hazelnut. The fridge was full, so I put it in a cooler with a kidney. But who cares?
Well, you called it.
Come on. I'll grab some jumper cables.
I'm surprised they didn't get the automatic defibrillator and just go to her car.
What makes a hospital great?
When they took the mammo machine back.
Is it the quality of the staff?
3D mammography fun.
The number of lives saved? The level of mammographical technology? Sure.
Mammographical. Why are they acting like the mammography thing is an unnecessary piece of tech? It's important to have good quality mammography scanning tools in order to diagnose cancer and treat it appropriately.
10% restocking fee for the boob scanner?
It's probably purchased on Newegg. Did you know that The Office actually has medical scenes? Click here to check that out, and as always, stay happy and healthy.